Hello everybody, welcome back to another episode of Back Pain Truth. I hope you all had a great weekend. It's been a wonderful weekend of Olympics. Not sure if you have had the chance to watch some of the amazing sporting events, and hopefully it will inspire a lot of you to take up sport, get fit, and which obviously will be greatly beneficial to try to avoid back pain. And just to think that, you know, a lot of these athletes have overcome at some point or more than once sometimes back pain as well to achieve what they have achieved at this Olympics or are in the process of achieving. So hopefully that should be a great incentive, and not just think that if you have back pain it's something it's possible to overcome. Now on that point, on being able to overcome back pain, I came across today an article on Science Network from the Western Australia, and it's about negative belief in back pain that fulfills the prophecy later in life. Now it's a study done by Professor Peter Sullivan from the Curtin research team, and he says that the degree of disability by pain is influenced more by beliefs than the degree of pain itself. Now if you remember in the previous video I talked about the overall approach, body, mind and diet. So mind is a very important part. Unfortunately, the majority of people just being looked at the local area of their back, but there's a lot more to it. It's so important that you have an overall approach in trying to deal with back pain. And I thought maybe it's just an interesting read. I know it just doesn't give you an awful lot, but it just goes to show that belief, your mind, how well your mind is balanced in dealing with back pain. And that's again going back to saying about some of these Olympians. Obviously at some point they've overcome back pain, but it's a mindset, believing that you're going to get better, that you're able to deal with it, and will be back to performing at your best, let's say, and being able to perform your day-to-day tasks again. The next one, it's something we've had a look at twice before. It's ThermoBalancing Therapy by Dr. Allan. It's a device which costs around about $130. Again, I'm a little bit, they say the word frustrated, but it's a shame. It's something, it's mainly been marketed as a device to deal with prostate type problems, but somehow it's also being marketed as a device to treat low back pain. Now, as I said to you before, just going back to what I said initially in this video, in the previous video, and always say over and over again, back pain products, pills, whatever they are not going to deal with your back pain problem. Sometimes, only sometimes, yes, they may give some relief. Is it maybe placebo effect? Does it really give relief? But the thing is, there's a lot more to it than just using a back pain product. Now, so please don't get what's the word I'm trying to look for? Don't go off and buy something like this. It's quite a lot of money as well for what it is, but rather spend your money on seeing a professional, get a proper diagnosis, knowing what the problem is, and get some advice on more than likely there will be muscle imbalances, as I said, things in your day-to-day life in relation to your mental state. I'm not saying you're crazy, of course, but what I talked about, the balance of the mind, your dietary issues, so many other things, and using whatever form of back pain product is not going to solve your back pain problems in the long term, believe me. Because talking about this thermobalancing therapy, I mean, the main website is finetreatment.co.uk, as you can see here, and it's very much a product that is marketed to be a helping prostate problems, although it talks about some other things it potentially is able to help as well. It talks about kidneys, heart, all those kind of things. So some kind of miracle product it looks like, but believe me, please don't go into think that, oh, I'll buy some like a back pain product and that's going to solve my problems. It doesn't work like that. There's a lot more to it. On that note, let's have a look at the other thing that I came across as well today on the website for you. Talking about an article on Natural News, talking about muscle imbalances that cause sway back and lower back pain. Now again, a muscle imbalance is something I always hammer on, such an important part of the development of whatever diagnosis that you may have, which is the stage 2. You develop a dysfunction of the spine, so-called muscle imbalances, causing a wrong torsion to be placed onto the spine, various structures like the disc coming under increased amount of stress, repetitive amount of stress. Now, this particular article talks about the kind of muscle imbalances that cause the development of sway back. In other words, I'm sure you see a lot of people that have like this increased curvature dip in their lower back, known as the lordosis, and it's also known as what they call the LCS, or lower crossed syndrome. It's basically the pelvis is tilting forwards excessively. Now, because of it, your spinal joints come under an increased amount of stress. The anterior part, the front part of the disc, come under an increased amount of stress, so eventually potentially bulging of the disc towards the spinal canal. Sorry, not towards the spinal canal, but towards the front area. One of the issues as well is that the anterior ligaments, the ligaments at the front of the spine, are on a constant increased amount of stress day to day, and eventually they become lax, or in other words, the length of those ligaments increase, and that can eventually cause to instability problems as well. So in other words, at the vertebrae, that is one of the bodies of the, so you got the disc, and on either side of the disc is what we call a body, the vertebrae, and that can eventually start to move forward or permanently sit forward. If it starts to move now and then forward, as a spondylolisthesis, and if it sits there permanently in that position, spondylolysis. Now, but basically it just means it's an instability. There's just too much movement. There's this so the stability of the spine becomes lost at a particular level or levels. Now this article talks about what kind of muscles you need to stretch, maybe certain muscles you need to strengthen. So I just thought this may be an interesting article. It's quite a common form of muscle imbalances. I'm sure you've seen a lot of people, they often develop big bellies as well. Part of the belly showing more as well because those stomach muscles start to weaken because of the increased dip in the lower back. That means that the stomach muscles are being stretched more, and when a muscle becomes stretched, they weaken as a result of that. So this is what the most interesting bit of information I could find today for you in relation to back pain issues. I hope you enjoyed this episode. As I said, there's lots more videos. You will see as well a link appearing that allows you to click back to the previous video. If there are new videos after this, you'll see a link appearing to go to the next video after this one. I would love you to leave a comment or something below, just any questions you may have. I'll personally answer all those questions for you. Again, thank you for tuning in to watch this video today. Have a great day and speak to you soon. Thank you. Bye.